Okay, hey Detroit, I'm Dr. Savannah. I'm gonna go ahead and help you today and see what's going on. So before we begin, I'm gonna let you know the different types of appointments that we do offer. We have an emergency walk-in, which seems like what's going on is an emergency, so that will be a $5,000 visit fee. And with that, if there is a situation where you need a prescription, that will go ahead and you'll get 12 pills with that. If you need something like more pills, for example, like 21 pills, if it's painkillers needed or antibiotics needed, then you can get that with our regular walk. I'm sorry, a regular pill appointment, which is 25K. So it's up to you. Oh, all right, you got that emergency visit one. All right. Okay, so what brings you in, Detroit? I'm here. I'm gonna just be quiet,
Well, Doc,
okay?
I wasn't sure if I was having a panic attack or what. You know, my life's been. I don't mean to intimidate you with my gang tattoos and stuff. You know,
Yeah.
recently I left the military because I realized it wasn't for me, and there was just a lot going on. You know, and so
Yeah.
I became a millionaire because my pops died. You know, and he had a life insurance policy that left me kind of straight. You know what I'm saying? So I became a multi-millionaire. And then, I always been a gang member, so it's just a lot because I'm not sure if my friends like me for me anymore, or if it's because I'm rich.
Okay, I definitely understand that, and I could put a lot of pressure on you. You know what? Do you want to come sit over here with me so I don't feel like I'm standing at you? We can be more at a comfortable level.
Sure.
Okay, you can choose whatever you like to sit at, and then I'll sit in the other chair. Okay, go ahead and continue. I'm listening.
Yeah, Doc. It's just been tough out here lately. And then, so since I'm in a gang, I got a lot of gang beef. And these streets, sorry.
It's okay.
And these streets, they want my head. You know what I'm saying? Sometimes I just get scared, so that's why I stand up because I don't know if somebody coming at the door or not. You know what I mean? So,
Yes.
sorry for being so paranoid. I
No,
feel like y'all here to help, but it's just a lot going on, you know.
I definitely get it. And you don't have to be sorry. It's very understandable.
Yeah, so I'm just, I'm not trying to medicate to necessarily take away the pain, but I do need some medicine because my back hurts. So I'm not using that as an excuse to get the pills, but I'm just trying to make it from day to day, Doc.
I get you. I definitely understand. So we're gonna go ahead. I'm gonna go ahead and get you taken care of. Okay?
All right, just can I get the strong stuff, the Percocets,
Yeah, I got you. Let me go ahead and do an exam, see what's going on, and based on what I see, that's what I'll go ahead and prescribe for you. Okay?
Okay, Doc.
So if you don't hear me talking, I'm just gonna write what I'm doing in chat. Okay? So it's gonna be a mix of me
Okay,
talking and writing. But I'm here.
all right, okay. Yeah, I appreciate you washing your hands, Doc.
Of course, of course. Okay, so one positive thing I would say is that your vitals are looking very good. They're in the normal range.
Yeah, I was worried I was going to have high blood pressure. I've been eating a lot of spicy foods lately, not sleeping and stressing. So that's a good sign.
Yes, very much so. So you say, um, do you have any medical history of high blood pressure?
No, I just think I got like really bad insomnia, Doc. I just, I assume everything's wrong. You know what I'm saying? I don't know if it's a bad outlook to have, but every once in a while, I barely get up to the doctor, so when I go, it's serious, and so I always think everything's wrong.
I get you. You've been through a lot, so you're just that's what's probably causing you to be anxious, you know. And so hopefully with me, you can go ahead and we can get that taken care of. And if you want to keep coming back to me, we can do like some therapy sessions. That way, it can go ahead and help with that trauma that you possibly have, the PTSD from being in the military, the trust issues from being in a gang, and you don't know who you can trust. Is it because I have money, or is it because you really are my friend? Are you looking out for me because I'm your friend and your brother, or is it because I have the money?
Yeah, yeah, Doc. I think those therapy sessions could be a good thing for me because sometimes I just get so stressed, and I don't want to sound like when I'm dealing with the guys, I gotta keep a persona.
I
You know what
get
I'm
you.
saying? So I can't get vulnerable with them.
I get
I
you.
can't let them know that like I'm stressed out. I'm constantly in fear. I just got to be a strong leader that they look up to.
Well, I am here to say that you're in a safe space. You're in a safe space with me, and I hope that you'll be able to be open and talk about what you're feeling so that way when you are with your brothers and, the members of your gang, you'll be able to just be chill. Anything they do or say, you can just brush it off your shoulder because you were able to talk about it and release it here.
Yeah, Doc, I do appreciate that. Hey,
Uh huh.
but Doc, I do have to, pick up my kids from school in a minute.
Uh
You
huh.
know what I'm saying? So, can we schedule an appointment for tomorrow?
Yes, of course. What I'm going to go ahead and do, I know that you have to go pick up your kids, but I'm going to give you something to hold you over until tomorrow. It's not a prescription, but it's just something to hold you over until tomorrow, and then we'll finish your appointment, do an exam on your back, most likely do an X-ray, and then we'll go from there. Okay?
All right, Doc.
All right. Thank you for being so patient, and thank you for coming to me for some help.
No problem, no problem. I think we all need help sometime.
Of course, and it's a good thing that you're coming. That's one step to your healing process.
That's right, that's right. What are these,
Okay,
Doc?
these here are antibiotics, but I didn't write a prescription for you. They're just over the counter. This is going to help you with pain relief for your back, and hopefully it'll help you get some rest tonight.
Okay, Doc. Yeah, yeah, I need that. Yeah, yeah. I just want to make sure because sometimes you take a pill and it has like 16 side effects, and I just want to stay as healthy as possible.
No, I get you. Now you might get a little bit not nauseous, so I recommend taking this with so sorry, taking this with food. Drink plenty of water and get plenty of rest. Okay,
Okay,
try to
Doc.
get
Yeah, that makes
rest
sense.
as much as you can. And if you,
Okay, yeah,
what I also
I can
recommend,
definitely.
oh, I'm so sorry.
No, you're fine, Doc. What else are you recommending?
Just like natural type of things. Like you can go ahead and get a journal. I'm not sure how you feel about journaling. Keep it to yourself. Maybe go to the beach or like to the lake or something like that and write out your thoughts. Because a lot of time we have so much in our head, we feel so overwhelmed. Like it's just so many things happening. But then when we write it out, we look at it and it's like, okay, that's not that much, and we can figure out a plan.
Yeah,
And go
yeah,
for some walks.
yeah. I was thinking about maybe taking a trip to the cabin this weekend and going fishing. Just doing something to just like relieve the pressure.
Yes, exactly. Do me time? Me time is okay. It's not selfish or anything like that, because at the end of the day, you have to take care of your first before you can take care of others.
Yeah, Doc. I appreciate. At least I hear from an expert because sometimes I just feel like I don't have enough time for me because I'm constantly, trying to make sure everybody's straight.
I understand that, and that's a good trait about yourself. So look at that as a positive. And now we're just gonna work on making sure you take some time out to work on you and giving yourself time to do you, whatever that is, whatever you like to do. Like you say, like to fish, take some time out, like once a week or once a month. Go to the lake and fish at the cabin. Just relax.
Yeah, yeah. I gotta make sure I start doing that more.
Yes, but baby steps. Don't pressure yourself to saying I have to do this right now. Because it's gonna add more pressure to you. Baby steps, one thing at a time, one day at a time, and you'll figure it out.
Yeah, no, it's just one day at a time. You're right, Doc. So what else do I have to do before I can go ahead and leave, Doc?
So, all I want you to do today, do you want to schedule a set time for your appointment tomorrow?
Um, what time do you have available on your schedule? Tomorrow's my free day. I'm kid free tomorrow.
Get free? Okay. So, I would say we can do you want to go ahead and sleep in tomorrow?
I mean, without the medicine, you think I should?
Yes, I want you to get some rest. Um, and your time zone, I'm Pacific Standard Time. So, what time zone are you? East.
Eastern.
Okay, so we're 3 hours difference. So how about a noon visit, like around 12 p.m. for you?
That works.
Okay, perfect. So that way you can get some sleep, get some breakfast in you, and then we can go ahead and take care of you. I'll do your exam, and from there I'll fill out a prescription.
Okay, Doc. Well, as soon as I pop in, I'm gonna call you to make sure that our appointment time is still scheduled. Make sure anything didn't pop up.
Okay. I'm gonna add you as a friend on here, and then would you happen to have a Discord? If so, I'll give you my Discord, and that way we can keep in contact in regards to your appointment.
I think I do have you as a friend on here, but I don't have Discord.
Okay, no worries. As long as I have a friend, you as a friend on here, we can communicate.
Okay, yeah, I'll definitely be on the route too.
Oh yeah, I have you as a friend already, so perfect.
Yep. Okay, Doc. Well, I'll catch you tomorrow for our appointment.
All right, so stay safe. Go take care of your kids. Go pick them up. I know they're excited to see you, and we'll see you. We'll go ahead and resume tomorrow.
Yep, that works, Doc.
All right, let me go ahead and get the door. Because oh, it's already open. Hold on. Okay, good. Because you know I'm
All
having
right.
trouble with our doors sometimes. Let me open the door.
Yeah. Okay. All right, Doc. You have a great night.
Same to you. Stay safe.
Thank you.
Thank you.
Put your gun away first. Now watch. Now watch me, Nene. Now watch me whip. Now watch me, Nene. Kaylin. Savannah.
Hey, Ray.
Hey girl, I see you keeping the room nice and tidy and clean.
I'm ready in EMS.
Yes, I am. How to get ready for our next
I took
patient
all
for
of
the
my
next
testing
doc.
now.
Less work for them to do
Yeah.
next time.
So hopefully I'm gonna ring.
Yeah, I'm excited.
You're excited? Oh, you have your interview tomorrow.
From
Ooh.
Malibu.
Yeah, I already passed the first test. I'm
I
excited about.
know. Oh, I'm happy for you.
Yeah, I'm doing all of the tests.
Things. I got a 10 out of 10.